Good morning. My name is Lucy Spruill, and I'm currently working as Public Policy Director for Community Living and Support Services, a provider of long-term living Act 150 and waiver services for adults with a wide range of disabilities. From July 1, 1998 to June 30, 2008, I was the Director of Act 150 and Attendant Care Waiver Services for Community Living and Support Services. I would like to thank Chairman DiGirolamo and this committee for convening this hearing and affording me the opportunity to present comments by videotape. This morning I would like to express concern about the lack of stakeholder input and collaborative planning for the delivery of OLTL services for more than a year, and the problems that result for consumers receiving services and providers doing their best to provide consumer-responsive, cost-effective services with demonstrated positive outcomes. As most people here are aware, Pennsylvania has been in the forefront of providing effective home and community-based services to adults with disabilities for more than 25 years. Community Living and Support Services has had a variety of roles in that effort for most of those 25 years, going back to the early 1980s when the program was a special project to demonstrate the effectiveness of serving people with disabilities in their own homes rather than institutions. It's important to emphasize that during most of those 25 years, providers, consumers, and state officials have worked together to provide one of the most comprehensive, responsive, and effective programs in the nation in good and bad economic times, and with administrations from both parties in Harrisburg. I believe we accomplished that by working together and keeping our focus squarely on the goal of keeping adults with disabilities who needed services as healthy and active as possible in their own homes and communities and out of restrictive and expensive institutional settings with much poorer health outcomes. For more than a year now, that kind of collaboration and communication has no longer existed. Stakeholder planning committees, including the Community Living Advisory Council and the Stakeholder Planning Team, have not met during the term of this administration. Even regular provider meetings no longer take place, having been replaced by one-way communications from OLTL and DPW, consisting of abrupt emails and other communications which appear unexpectedly and generate questions. We have been told by administration officials that meetings for the purpose of planning, collaboration, and communication regarding service delivery and program administration are a waste of time. These officials will meet with only the Medical Assistance Advisory Committee, presumably because they are required to do so by federal regulations. OLTL quality assurance, which used to include regular in-person contacts between OLTL staff and consumers, as well as intermittently mailed surveys, now consists only of audits of paperwork. A recent request for application released by DPW was so confusing, unusual, and arrived with so little background and explanation that it generated more than 400 questions by prospective applicants during the pre-application process. Many of those questions were never answered by the department. More than a year ago, the department formed committees for providers and DPW officials to work together on a rate structure that would work better than the one we have had for several years. Unfortunately, these committees virtually never met and were not productive. Most of the few meetings that were scheduled were canceled at the last minute by the department, and we recently received proposed rates that will not work for most providers. A single out-of-state business, which was awarded the contract for enrolling consumers in Act 150 and all waivers serving adults under 60 has had consumers in the enrollment process for as long as a year without explanation. 2 consumers were recently referred to class by this contractor who are in the late stages of pancreatic cancer, having been cared for by struggling families who did the best they could for almost a year before the consumer received services. Another consumer with multiple disabilities died a few months after going a year without services after he was determined eligible and ready to begin services by the enrollment broker and with public pleas by his family to begin services. Numerous applicants for services have been told by the enrollment broker that class is not accepting any new consumers, even though that has never been true. In the meantime, we receive referrals from the enrollment broker with no more information about the consumer than a name and phone number, and we are supposed to decide if we can meet their service needs on the basis of that information alone. Because there are no regular and effective channels of communication between providers, applicants for services, OLTL staff, and the enrollment broker, no one has any idea why these tragic situations continue to take place. Within a few short months, the department is about to make more major changes in the ways fiscal management services for consumer employers and supports coordination for all consumers are delivered, and yet there has been no communication with consumers by OLTL or DPW and no guidance to providers regarding what we are to communicate to consumers and when. These changes will result in many more staff layoffs than have already taken place and major changes in procedures for all consumers and attendants employed by consumers, with no evidence that there will be adequate planning for the changes to be understood and implemented smoothly and effectively. We ask that the Human Services Committee do everything possible to reinstate regular channels of communication between OLTL and all stakeholders, and above all, prevent the extension of Act 22, which has contributed to this state of affairs, where one Commonwealth department operates programs that affect millions of Pennsylvania citizens in an isolated, autocratic manner with no feedback asked for or obtained about the consequences of one-way dictates. Thank you for hearing my concerns.